Well, joining us for more about Lagos's feat, and that's vaccinating 4 million before the Yuletide. Dr. Ajoke Adewale, a public health physician, joins us from the United Kingdom virtually. Thanks for joining us on the program.
Thank you for having me.
All right, just before we talk about Lagos, let's talk about where you are in the UK. I mean, that's a country that has almost everyone vaccinated. I mean, what does it feel like?
I mean, definitely people are beginning to relax off the masks, but it's because they've been vaccinated. You have a lot of vaccination areas, a lot of support. I mean, I volunteered with the NHS, so I'm one of the steward volunteers at the vaccination centers. So almost everyone here is vaccinated, and it's making it easier to, relax the COVID-19 lockdown measures in terms of, the masks and the rest. So it's a good feeling of being protected, and even regular healthcare staff get tested weekly. So on a weekly basis, you just get your swabs delivered, you do the test yourself, you drop it, and every week you get a message to know what your results are. So despite being vaccinated, you get monitored and you get all the support you need. It's a nice atmosphere, yeah.
That is quite interesting. But let's talk about Lagos, the efforts of the government trying to vaccinate 4 million before the Yuletide. What do you think? Especially also having private hospitals begin to dispense the vaccines for a fee.
Yes, well, I applaud the efforts of the government. It's quite ambitious, seeing that the Yuletide season is already here. We have to admit that Lagos State is a different environment, different from other states in the country, and also different in the sense that it's the economic center. So it is very overcrowded. The WHO suggested or requested that countries should aim for 40% vaccine coverage, and we are still way above and way below. We are around 3%, so we're not even where we need to. So working with the private sector, I think that it is It's innovative. It's a good thing. It's something that should be applauded, because we know that a great chunk of the health sector is driven in the private arena. So in as much as people will come to the public, many people would find it more convenient to visit their private health facilities. So I think it is a laudable, innovative way to make sure that people everywhere can get it at their comfort.
What do you think are some of the challenges that we might face, especially in the modalities for the exercise? And there's also the fear, what if vaccine hesitancy gets in the way? Because this will in turn affect the potency of the vaccines, wouldn't it?
Well, I know that the first thing would be to criticize the fees being put on the vaccine, being associated with getting the vaccine in the private hospitals. So many people are going to criticize that, but the government has explained that it's for administrative costs. This money is to be paid through the government website, and that all the processes of quality control will be ensured. The obvious challenges I just see is to make sure that those quality control are indeed enforced. We want to make sure that the same standards that are being observed in public vaccination centers are what are being observed. You want to make sure that the cold chain is being the cold chain is what makes vaccines potent. So we want to make sure that even when these vaccines are in the private facilities, they are still potent, they are maintaining the cold chain, there are no corruption practices. Hospitals that are not regulated do not get it, and they do not inflate the prices or the rest. It is doable. I mean, over here, you find out that pharmacies, several places, universities, a vaccination point, although it is free, but we have to compare these things carefully. So I think that the obvious challenges is just about definitely the fact that corrupt practices, maintaining cold chain, ensuring quality control while we are giving private facilities, and making sure that people are not going behind the system, which still boils down to the corruption I mentioned, so that they get this vaccine. They don't turn this vaccine into a profiteering event.
All right, we'd like to appreciate your time. Thank you so much. Dr. Ajoke Adewale is a public health physician joining us from the UK. Stay safe.
Thank you.